Hey, everybody!
Welcome to Lady Vibe.
Your podcast for better well being.
This is your co-host Dr. Ning.
And I'm your co host, Rachel. Thank you so much for joining us today.
Today, Rachel and I are going to continue our Healthcare Heroes series. Um, as we mentioned before, in this series, we really want to get healthcare workers in different sectors of healthcare industry to come to our studio to tell their stories, to share their journey. And also, we want to take this opportunity to recognize their contributions to healthcare to their patients. Um, so today we have the honor of getting my dear friend, Dr. Olena Svetlov, into our studio. She is a seasoned clinical nurse specialist. You probably have not, a lot of people probably have not heard about this title, but she is going to tell us all about uh, this role and how she get here, and what she does. She does a lot of cool things that we're going to explore together today. So
Yeah, and then
welcome.
thank you so much for having me. Let's just be like that. Let's just call me Olena.
Okay.
All the titles are not here because it's a ladybug, right? For the best.
It's a lady vibe. We're chilling.
Yes. So I'm
Yes.
here. Thank you so much for having me. It's an honor, and I'm really actually happy that you're doing this podcast for, and acknowledging for people who really dedicating their lives, protecting our patients, protecting our loved ones, and making sure we're all good. So thank you so much for creating this podcast. It's an honor.
Absolutely.
Pleasure is ours. Yeah. So, Alina, you have a very unusual career path compared to a lot of the nurses who get into, nursing career early stage of their life, and that's what they wanted to do since they were a kid. So I'm curious, what did you want to become when you were a kid? Like, what were your dream? Like,
Oh my gosh. It's a good question. Well, full disclosure, I was born in the Soviet Union, Republic of Ukraine. So at that time, we were not actually allowed to dream that much. We had our leader, and then we had a 5-year plan that everybody's supposed to meet in those plans. And all the aspirations, achievements, actually, and possibility of achievement started when the Soviet Union collapsed. With the era of Gorbachev, when the 88, 89, and 90s, and when the collapse is happening in 91, 92, when the country of Ukraine became independent. So the whole world opened up for us as a teenagers that, oh my gosh, there's a world out there.
yeah, I can do whatever I want now.
Exactly,
Yeah.
exactly. And now I start thinking, oh my gosh, what do I want?
Right.
And what do I like? And I'm grateful to my grandparents who actually allow me to think that way. And I didn't go to the engineering school, even though I got it. I
Yeah.
was like, where is engineering? Where's Alina? And my mom and my grandparents supported me to go to the teacher training university and become a teacher to learn Ukrainian language, literature, English language, and world literature. So
That's
yeah,
unusual, right?
yeah,
Like
yeah.
I don't know about Russian culture, but in Asian culture, they don't want you to get into those field because you don't really make a good living in literature.
And
So
imagine this is a country in collapse, right? It's a new
uh-huh.
country of Ukraine is emerging.
Yeah.
It's a huge Russian pressures, like what
Yeah.
we're gonna do.
Yeah.
And yeah, I'm really grateful that my military grandparents and my mom actually supported me to
Uh-huh.
this.
To pursue your
Yeah,
dream. Yeah.
yeah,
Yeah.
yeah.
So you wanted to become a teacher and you became a teacher.
Yeah,
Yeah,
it's so
like
true.
that. Yeah.
Yes, yes.
And then when did you come to the US?
Yeah, the first I came in 2002 for the Work and Travel USA
Uh-huh.
for the program English Reduction, Accent English and Columbia University.
Yeah.
It was through it was some kind of like exchange program. You come in on a G1 visa, and for 6 months you practice and you taking classes, and at the same time you're allowed to work and explore American culture. So it was just, gosh, you're coming in and everything's so big, it's so beautiful, and people are so free. They can actually speak whatever they want. Yeah, that was really a shocker.
But at that time, you're not thinking about a medical career, right? Like,
I actually be honest with you. So in Soviet Union, you either have to have back then you either have to have a family relationship and to go to the medical field, or you have to be really genius, or you have to have money to kind of like invest into your admission process. So single mom and grandparents. No relationship to any kind of medical, but I did want to become a doctor actually. We didn't really know about the profession as a nurse back home. It was more doctory.
Doctor,
right. It's probably the same back home.
You thought about becoming a doctor,
Yes,
but there was just no means for you to get there.
No. And then we just realized, okay, well, I really love poetry. I love languages, and maybe I can go and develop myself in this way. And it's more like, I didn't see myself with the machinery and engineering and building all this like blocks.
You're
and
a people person, like
Yeah.
As you see, I totally feel, that's true. And back then, so the goal was just to learn English, learn the culture, see what the opening or positioning are, and trying to see like what can I bring home, or did I have a thought would like to stay? Yes, it would be nice to stay, but I promise immigration officer that I will come back. Because he was asking me like, Olena, I think you're gonna stay, and I'm like, I promise you, I have my PhD project.
I will go
I have
back.
a boyfriend back home. I have my students; they're waiting for me.
Oh.
So I did come back, and I came back on time.
You did go back.
I did go back
after the program. Yeah.
But second time when the officer was asking me a question, I was very smart answering that, and I said, you don't really know how it's going to turn out. If I'll have a work or job opportunity, I will definitely pursue that. And I was open in my interview. And I think what America, well, for me being at that time Ukrainian citizen, I think honesty is really trustworthy. I think they see it, and I think this is what America wants. Work ethics, good people with skills. And I was honest at interviews, like, okay, if something will open, I will consider it. Will be honored to work for a country like that.
Yeah, that's
Love it.
awesome.
So wait though, then the pivot to nursing, how did it happen?
So I was already here, and I was working for a bank, and I was trying to see what can I be in this country, because that's not what I thought would be. I see there's so many opportunities, but I was thinking in the long run, as a girl, like how would I want to be contributing to the society? Like it's really like look inside.
Yeah, it's very thoughtful.
Right.
Yeah.
And you're like, oh my gosh, this is a place where I actually can do something about it. And I had a beautiful friend at that time. We're still connected. Her name is Lydia Melendez. And here I work at Countrywide. So we actually had a lunchtime, and I was telling her, hey, I would like to go to medical field. I would like to care for people. I'm not sure if I can do the doctor, but maybe I can do. And you know what? She just looked at me and says, Olena, you can do whatever you want here.
Aww.
Oh my gosh, how can I do that? And it's like, I think it's a girl support, she was a little bit older than I am at that time. And she just literally like, no, Olena, there are like programs, they can support you. There's scholarships there, you apply, and there's like some support you can get, and then there are loans, right? Their government are interested to support you. I was like, what is loan? Like English not a first language, so it's like, what is a loan?
They were taking a loan.
Yeah.
And then she gave me a very wise advice, like, why don't you explore? Why did you volunteer? So I applied for volunteering option. I went to, and you know what? Out of all the volunteer options, UCLA took me as a volunteer. And I recall, like, I was already pregnant. So Monday through Friday, it's Countrywide in Simi Valley. On Friday night, you're like, you driving with your belly up, driving to
Oh.
UCLA on a late shift, like from 6 to, I don't know, midnight or something.
Oh my God.
And you drive, 118, 405, our parking lot over there, right? And then one day, I was just doing it to see if I can go to like medical school or whatnot for experience. Gosh, that's a good question. You guys asking good questions.
So volunteered in the hospital.
Yeah, I was volunteering at UCLA, old building at that time. And I recall I was assigned to a phlebotomist to see, what the process is and how the system works. And what happened is there was a patient who was shaking and nobody could get blood. So the phlebotomist who I was with, she was called to get blood from that patient.
Yeah.
And I just follow along just to see. And I'm walking in, and I'm scared. I never seen the hospital inside, never seen patient. And I recall, like, oh my gosh, there's a huge bags of blood. Now I know it's a blood transfusion, but in my imagination, it's like a huge bags of blood. And he's shaking, he's not listening. And then my phlebotomist couldn't get the blood either. So he got more agitated. So the nurse comes in. I'm like, who is nurse? I'm trying to see nursing, in Ukrainian nursing is like breastfeeding. I'm like, who is a nurse? I'm trying to like comprehend this. And then, you know what she did? She said, I'm going to get you. So she got the hand and she just talked to him. She just looked at his eyes. And I don't know what she was talking about, but that feeling of calmness, that presence, just, oh my gosh, I want to be like her.
So she calmed him down.
Oh my gosh, everything. Yeah. They were like, she didn't give him any seizure medication. She didn't push any drugs. Like I'm thinking, oh, maybe like Ativan and he's out, right? No. She was there. She talked to him. He relaxed. And my phlebotomist preceptor, she drew blood with no problem. And after that, I was like, oh my gosh, I know what doctor does, making decisions, navigating the care, going through all these barriers, right? But how and who can get those orders executed? And how do you get the family and the patient to be together and collaborate? And I was like, oh my gosh, who are you? And I want to be like you. So long story short, Lydia Melendez, if you ever get to listen to this podcast, Ladybug, thank you. She gave me a great advice and I followed. And then I followed the steps. Got to CSUN. Thank you, my professors. And I got to the most beautiful profession in the world, that we are supporting everyone. And I think we're like a link as a nurse. Like patient and a family and wellness and recovery and being in critical care, perhaps and most of the time we're like that bridge on the other side.
I'm sure it's humbling, especially seeing people that, struggling, right? And so you're the hands and feet to help them really get to where they need to be. And I'm sure even hearing their stories and being a part of it, you will never forget those people.
Yeah. So I'm just curious, like, like we want to give young people some useful advice, right? Whoever wants to get into a nursing career, we can tell you get into this with all the passion, right? Like to take care of people. Like, was it hard because you did not have any biology or medical background? Like, was it hard to going through nursing school?
I was surprised. Actually, the Soviet Union prepared me very well. I thought I'm never going to make it, but chemistry, biology, it was just a second nature. But I was thinking, like my mom was telling me, Olena, you always wanted to be in caring. So I guess like God moved me in that direction. So it was very easy. I have the best professors, prerequisites. I was looking for looking to learn, and professors actually were willing to explain. That was very, different from back home. Yeah, they were guiding me, and I remember like in chemistry we were doing like a logarithm of the value, and like okay, logs log, and I'm like, oh, okay, I remember that. How is it? I don't know how to say it in English, but I remember how to do it. And my professor, just show me how you do it. Just draw it out, and like draw it out. He's like, pass.
So what
So
are what are the basic courses like for nursing?
Yeah. So for anybody who would like to become a nurse, definitely get to a college advisor, and depends on which colleges you're going to apply. They're going to give you a list, and I was looking, local here in California, so they practice English 101. Why it was very important to me because English not a first language, and even though back home I was associate professor and I'm teaching English and had my ego like through the roof, who are you telling me that I need to take English 101? Yeah. But it was really cool, like actually how counselor explained to me that, Olena, you will learn more on the culture. So I get to take English, I think 82, then 85. And I learned how to express myself. I hope I'm clear by now.
You are very
oh,
clear.
you're crystal clear.
You're like
Yes,
a
college
native
is all to
speaker.
you.
Yeah.
Yeah, and I learned beautiful poetry, Thoreau poetry, who actually, we have a street of Thoreau here in Southern Oaks. Yeah, I really appreciate that counselor advice. So please listen to your counselors, even though you disagree. Yeah, and then after taking these classes, so you are advised to take chemistry, organic chemistry, if you want to get to university and nursing program. If you want to have a community college, you might not be taking organic chemistry. Microbiology, biology, psychology 11. Just a basic psychology, what it is. No, psychology 101 and history 11. And history 11, it was actually very helpful for me because I was in preparation to get my immigration exam. So I didn't need to pay extra money. I was very well prepared.
You probably
Like,
know more
check.
than a lot of Americans born here who are born here.
Yeah, you probably know more than me.
I doubt that you have an intuition level. Not, yeah, but I had a wonderful professor. He was. The way how he was talking about Star Spangled Banner, I still see vividly. I see these
Oh,
people, and how they were, gosh, like dead people there, and they're holding that flag, and the voice of the most popular song at that time. That I don't know how the vocals get to that level, but they were like, oh my gosh. And then and Boston Tea Party, the way how he explained it to me. So like 20 years later, I'm in a conference, and for me, like Boston Tea Party. So Boston is a city, and the Tea Party. I'm like, okay. So they drop the tea bags, and they're like, English not a first language, and they are drinking tea, and I'm trying to comprehend.
you're like
What
literally
is the tea
interpreting
party?
these.
So party and the war does not get together, it's like not coming in together. But like 20 years later, I'm in Boston. I'm speaking at a nurse practitioner conference, and I'm like, I want to see this Boston Tea Party. I want to go see it. And you're standing at this area, and you see the ships, and you see people just crossing, and you see these old buildings.
Yeah.
And like, God, thank you so much. I'm the best profession. I got best professors. They
Oh,
put so much in me, and here I am.
Yeah, I mean, who wouldn't like a student with great passion, want to
yeah.
learn and want to become better. So after you finish the bachelor program in nursing, like you move on to, did you practice for some time?
Oh, yeah. Well, I got an accelerated program, so I got admitted first. That's a whole process. So I want to share that pretty brief. So don't focus just on your 4.0 GPA. Just focus on who you are as a human, because in nursing we actually love, and what I realized, we love have human beings by the bedside, and really understanding. Because if you're just the executor of the orders,
Right.
then the mistake's gonna happen and damage gonna come. Because humans, might change your blood pressure just like that.
Yeah.
right?
Yeah,
Yeah,
so
you probably see it too.
unpredictable,
Yeah,
you know,
as a
like
doctor, you
they can change, their condition can change
yeah.
any second.
Yeah,
Yeah.
and who is to report immediately to the doctor, right?
Yeah.
So I'm not gonna, give the blood pressure medication if the blood pressure low. So I have to report it to Dr.
Yeah.
Nina would probably report it to you right away, so you can come reevaluate and then we can adjust something.
Yeah.
So critical thinking is very important. So don't focus on your 4.0. It's not about that. And then when you have your interview, they will be asking you like, why do you want to become a nurse? So really, like, it's a deeper question to yourself, like, why did you want to become a nurse? Some people want to, like, oh, I want to be a nurse leader right away. That's a good passion. Yeah, you want to be a nurse leader. But at first,
It's
Why?
not happening in one day, right?
Right.
and why, right? And why? And then, but the word nurse by itself, I'm caring for you, right? I want to provide care. And then out of it, you will become a leader in caring, right?
Right,
So,
right.
yeah.
So in your current role, like lifestyle, let's talk about what is the clinical nurse specialist kind of hours? Like what, like, do you think the pay is good? Like people want to know.
People want to know.
Actually, I want to talk a little bit more about what does, you did nurse practitioner and then, you know, with like get additional training to become a clinical nurse
It's called
specialist.
it's a dual training. Yeah, thank you for asking. Dual training. I went to Azusa Pacific University after 5 years being a nurse because I thought, like, ethically, before I become a nurse practitioner, I was thinking like go to nurse practitioner first. I need to actually to know more.
Yeah.
And you're going to be respected more by providers. You're going to be respected by patients, and you will feel more confident in caring because you've been through the processes. You've seen so many people with a different diagnosis, right, in their lives and everything. So you build up that rapport and how to deliver. So yeah, so after 5 years, I went to Azusa Pacific University. It's a Christian university. And they have a class especially for spirituality, and I really appreciate that class because it's actually even getting deeper into you, like why you choose to become a nurse. It's like second guessing yourself in a way. Am I the right person? Am I in the right track? So really grateful, great program. And then I think like 2 years in, one of the counselors, Miss Barbara, she talked to me like, hey, Olena, I think, I've been watching you, but I think you'll be good at a good CNS. And I'm like, central nervous system?
Right, CNS.
Thank you for a compliment. She's like, no, it's a clinical nurse specialist. I'm like, what is it?
You had no idea what it was either. Okay.
I was like, hey, I want to be my adult gero. I want to, commit to my gerontology and my elder people. And then she basically opened up the world to me. I had great classes with professors that I learned a lot. That clinical nurse specialist is an invisible gem on every institution. Because why it's invisible? Because we're so humble, we never show ourselves anywhere. But we are hidden heroes by the bedside. We are making sure that every new nurse that comes in the hospital getting the best evidence-based education training. We work collaborative with education department, and we are leading and we're working together to make sure the nurse is getting the best. We're also working, we're clinical leaders, so we're making sure that whatever equipment comes out in the market, we evaluate as a good for our institution and as how it's going to help us with our cavity rates, like it's a catheter-associated infection in patients, or with any central line. We put the central line in the patient, and high risk for infection, right? You probably seen it, right? So I get to sit at the table with other leaders of organization and bring my expertise as a clinical person that says, hey, recent study shows that we actually need to address this problem this way. Doctors might say, hey, in my school of thought, I went from Pittsburgh and this is how we do it. One says, doctor, with all my respect, your year of graduation, 1995. We have some recent articles and support, and there's more technology coming in. and they're welcoming to look in this literature, or we write policies and procedures.
Uh-huh.
So, for example, current practice, let's say in East Coast, to do certain things some way. Here in California, we don't think so. And here, like, for example, in institution, I don't feel it's safe because we have a different climate, we have a different type of population. We address it there. We also write pathways. So, for example, the hospital would like to get awards and recognition for their outcomes.
Uh-huh.
So we are partnering up with the quality department.
How can we get there?
Yeah, yeah.
Yeah.
And there are programs like Magnet, there are programs like Beacon, and I'm, I'm a part of ACN. I'm probably wearing my jacket with American Association of Critical Care Nursing. So it's a professional organization where unites all critical care and acute care nurses. So they always putting out in the best, evidence-based, researches, quality improvement projects, and they're choosing like what the nurses are doing in their hospital, and then they're putting like in the hub so the other nurse can go on the website and like read about that project. And me as a CNS, I'm like, hey, the hospital in Omaha did this and this. Check it out. Or like my dear friend, like she works in Midwest. Like, hey, she did this and this for the rapid response, and this is what she implemented. Let's bring over here and
knowledge
see how
sharing. Yeah.
yeah. So, and then we're kind of like contagious with what we do, and nurses got excited. Let's do this and that. And you give a year into practice, and as a CNS, you see your nurses presenting at a national level, international level about their outcomes. The hospital leaders very celebrating the achievement of the nurses, and this is how hospital become magnet hospital. This is how the hospital become #1 in California and #2 in the nation. Or you are achieving benchmark, overachieving benchmark that you never done it before, but who helps you CNSs. We are ladybugs.
Ladybug.
And I see, like, because they're little, they're in the garden. And, like ladybug by itself, they
it plays a big role, in
we're tiny, but we're taking care of a garden. And this garden of caring for people, and there's people in the organization, and at the same time we're caring for organization, and we're giving a skill set to create this environment where nurses are flourishing with their practice, nursing leaders are growing, they are able to implement their vision, and we're helping them as CNSs to implement that vision. So I always say that when we work with nurse managers, we're like, nurse is nurse. We're here to support, and how can I support as a CNS organization, or how can I support my doctors, or how can I support my residents so they're not getting any like bullying, or have the best patients to learn from and stuff like that. So it's the best profession. Okay? It's the best profession.
How is it that you get buy-in for your projects?
Oh, yeah. I've just each hospital has a nurses, and they go to the group. So it's called Unit-Based Practice Council, and they would like always to like improve something. And if they are working on one project, you just tell them like, hey, my story. So I show them ACN website. I show them how in the past my chapter or my nurses presented, and I show them how this big celebration is. And for nurses, it's all like meaningful recognition. So it's not all about money. I know you're asking pay, like how the pay is good and whatnot. Pay comes in, we'll always start low, but it comes, I would say it's enough. And, especially in California, we have ratio, and I've got, of course, they're looking and making sure it's a market-based and everything. So depends on the lifestyle, but I'm just sharing, like, married, 3 kids, I have my little house in Calabasas. It's all enough, and we travel once a year.
It's a
so
hero mom with 3 kids. I don't know how she does it. And she spent, you get to work at 8, 7?
It depends. Yeah.
Yeah,
It
and then
depends. Yeah.
she literally just got off work and came to our studio and have not had dinner yet. I actually just grabbed her lunch when she got to my
That's
house.
a real hero. You're here to talk about what
7
you
p.m.
do too.
Like, yeah, so it definitely busy, but I can
Yeah.
see that like in this role, you do get direct exposure to clinical practice,
Yeah.
right? You don't take care of patients directly, but you watch how those
We
nurses
do.
do. You
So
do.
as a CNS,
Uh-huh.
you have a choice. You can be in different settings.
Mm-hmm.
But for example, my day look like well, right now I'm on orientation, but in my previous job, so the work schedule is very varies. And as a CNS, I don't need to show up like 7:30 and to report and anything. But I felt that it's very important to be there in huddles with my nurses, to check with the nurse manager what is the most critical patient that I can see, and check with medical directors if something going on. They want me to work with residents and support them. But I usually see most complex patients as a specialist. I am actually a cardiac surgery specialist, so I see most complex patient first, and then I go see my heart failure patients then next. Most complex, those who are on the devices. Or the nurse might text and says, Olena, I've never seen this before. Can you check this rhythm before I call the doctor? So I go in and I see and evaluate and, get 12 lead EKG, alert the nurses, alert the doctors. And then second part of my day, and usually starting from lunchtime, we have meetings, of course, organizational meetings. And then the second part of the day, you focus on either writing policies, procedures, or we're actually developing some kind of a guideline or curriculum, working
Love it.
on my class. Like today, before I left, we had a conversation. I'm teaching tomorrow PA catheter, like basics hemodynamics. But even though like I've been in this role for 11 years, I have my slides, I think I'm good.
Yeah.
But I think it's right. I think it's important to check in with other experts who are in the organization and been there too. So I kindly ask if there's a time to check in, and they can review my slides, and and we adjusted, and they're like, no, Lena, we don't want to adjust anything. I said, no, let's do how you wanted to do it. There, because each audience is different, so we just adjusted the slides, making sure it's appropriate for this. It's going to be pulmonary hypertension focus, policies, so I kind of like adjusted those slides, and I feel ready and excited.
Oh, yeah.
So tomorrow is going to be my first talk, and see how it goes.
At the new hospital, yeah.
Yeah.
So
I think the cool thing I learned from you is that, like, so we have a parallel role at a medical device company, and it literally is called a complex clinical. Like, that's the title. And the complex clinical at Gore, we do, these complex aortic aneurysms, complex peripheral cases. These patients are very, very high risk at, potentially experiencing mortality if the device is not correctly put in and things like that. But our team will actually fly all over the country. There's 10 complex clinicals that will go. They'll say, hey, tomorrow we need you in California. Tomorrow we need you in Texas. And they will support, the most complicated, challenging patients. So it's comforting to know that there's a you in the health system supporting these harder cases.
Yeah, so that's exactly what my role is
Mhm.
as a CNS. Be there in a highly complex. Like at my previous organization, like the nurses were not that accustomed of putting patient on ECMO. We created a program where we together as organization, and leadership you get buys in from leadership as well, because as a one person you cannot do much.
Right.
It's definitely
I mean, you make the policy. In order for it to be implemented successfully, you need the leadership support.
Yeah,
Right.
yeah.
So you have to bridge that gap between leadership and educate them about the importance and
Exactly. Yeah. And also just ask them, even before the implementation, I often have a conversation with my doctors and my leaders. How can I support you? What's in my vision, I might have like Manhattan in my light and the moonlight, right? But in their vision, they would like just to achieve that, and you help them to achieve that, and then they see see the trust and they see the result,
Yeah.
and then it will support you more.
Yeah.
So please become a CNS.
It's a great profession.
Yeah,
You
yeah.
know,
And if you think about it, some CNSs, they chose leadership track, and they become clinical. They become chief nursing officers or chief nurse executives. One of my greatest leaders that I had an honor to practice, and she actually hired me. It was Dr. Linda Burns-Bolton. She was a 40 plus year experienced CNS, but she chose operational leadership. I chose clinical leadership and lead nurses clinically and making sure everybody in system are supported with that.
Yeah.
I don't know how my life put me somewhere. I definitely like to lead, and as a nurse, I'm leading clinical practice. That is something humbling and reassuring, like, for your company, that hey, there is CNSs in Magnet Institution. There's no way you can have a Magnet Institution with no CNSs, because we're out there.
You make me feel like I can trust the hospitals a little bit more now.
Yay!
For the
Woo-hoo.
care they provide, right?
Yeah,
Like
absolutely,
someone
yeah.
are there, like
Yeah.
to make policies, guidelines to
Yeah.
ensure the quality of care.
Absolutely, evidence-based.
Patient.
Sometimes we have evidence-driven practice as well too,
Yeah.
because maybe and then you assist doing researches. So
You can generate the evidence and
Yes, yeah.
contribute to the evidence
Yay.
base, right? Like so, yeah. And Olena is well published as well. So yeah,
thank you.
and I also want to acknowledge that you have assumed so many leadership roles in different
Thank you.
professional organizations, right? That's
Oh,
a
yeah,
that's a big commitment,
Thank you.
in time. So
Thank you.
that
We say we were
dedication
contagious, as a CNS. I think as a CNS we bring the light and we unite, and I think with those bridges, I'm deeply grateful. I had an opportunity to lead my team during COVID at the ACN San Fernando Valley chapter. I have a phenomenal group of nurses who were my charge nurses, my mentors, and who helped me to become a leader. And ACN actually creates this every year. They have like leadership workshop. So you might not get it like at the hospital, for example, but you can get your leadership training at the ACN and those workshops. They have like once a year, they have a phenomenal conference. And imagine like nurses all over the country, they come as like 10,000 nurses.
wow.
Yeah, and they're just like there and learning, and you're learn from the best and speakers and get inspired, and it's fun. It's a fun profession. Yeah.
Yeah, I can tell. She works so hard without complaint, so that says a lot.
No
So
complaints.
yeah.
Just a solution. You always have a solution. If I don't like that, let's try the policy. We'll change it.
Yeah,
Yeah.
I like that. That's what we do as well. We all want to contribute,
Yeah.
to better change
Yeah.
in the world,
Yeah.
right? So yeah,
In the world. Oh my
Yeah.
gosh, that's a dream. Yeah, but actually, I had an opportunity to speak with some nurses from different countries, and that nursing, it's as a doctor, it's anybody who is in caring profession. I think we just dedicate ourselves to humanity. Period. When people are in pain, it doesn't matter like what language they speak, what religion they
what
carry.
race, ethnicity they are, you want to help them.
Yeah,
Mhm.
yeah,
Yeah.
yeah.
That's what healthcare is about.
I know. That's why we're all heroes for that. Thank you for doing that.
We really appreciate your dedication
Thank you
to
so
patient care and to improve the quality of the hospital services overall,
Thank
and
you.
your dedication to educating the next generation of nurses.
Thank you.
And for our audience, anybody who wants to get into the nursing career or become a CNS.
Become a CNS. Become a CNS.
Yeah.
She supports it.
I know, and
You can even find Dr. Svetlov on LinkedIn. On LinkedIn, she'll be happy to be your mentor and guide you into the door.
Yeah. Chat me in there. I check it. I turn off my phone like after 11:30. But I wake up early, so the message will come in. I do see the messages. I
Do not respond to midnight messages.
Yeah, guilty of those.
Yeah.
Yeah.
So yeah, thank you so much for coming to our
Thank
studio
you.
tonight.
Thank you so much. Yeah, it's an honor.
And hopefully we can talk to you more about like geriatric care. I know you have a great passion for
I would love
geriatric
to.
care,
Absolutely.
and I would like to learn more
Okay,
for
yeah,
the
of
sake of
course. Yeah.
myself and also my seniors in my household.
We'll
So,
have those, right? So it will
yeah.
be a
Yeah.
lot to share. So
Yeah,
thank
yeah.
you.
Thank you so much.
Yeah, thank you so much. Thank you, Dr. Zintal. Thank you, Rachel, Ning,
Thank
Rachel,
you.
Olena, and
Yeah.
thank you all. Thank you so much for listening to us.
Yeah. Have a great day, everybody.
Have a great day. Thanks so much.
Bye.
Thank you.
Bye.
Bye.